How's it going, everybody? Braddock here, and today we're looking at my active shooter mass casualty bag. So a little bit about the bag. This is a 511 UCR sling pack. It's designed primarily around medical response services. So anything like mass casualty, active shooters type scenario, this is a bag you want to be able to deploy for those reasons. So let's go ahead and dive in and look how I set this up for my personal use. So down at the front, you can see we have a identification tab here. This is Velcro, so I can move it from pack to pack. Triage is most important in any mass evacuation or a mass casualty situation. You need to be able to identify and rate all of your casualties coming in and out of a hot zone. So identification, triage is your #1 go-to. Down at the bottom, we have a nylon litter. This is rated up to roughly 1,200 pounds, so a great way to evac a patient out of the X. And then down at the bottom, we have roughly 21 feet of 1 1/4 inch nylon webbing to be used as some sort of hasty harness. So a lot of uses you could do there, halo harnesses, etc. Again, evac patients or casualties off of the X. So let's go ahead and run off to the back. What's really cool is they have this mesh compartment here. I just keep a quick couple accessories here. Over here we have a some trauma shears on a lanyard so you won't lose them. We have a permanent marker to identify again and be able to triage your casualties. Going back to our identification, we have a fluorescent vest, so you can identify that you are not hostile to that environment. You are there to somewhat help. And since this is a mass casualty bag, you're going to be dealing with a lot of different patients, so it's really important to be changing out your PPE as you move from patient to patient. And also, there may be a few individuals around you that want to assist, that want to help. So being able to throw on another set of gloves as, again, you move from patient to patient is very important. So this is like a condor glove compartment here. I have a bunch of gloves on the inside, and you just rip them out like so. I like blue. It just shows up, blood shows up a lot better on blue. And then what I like to do is my bottom layer will be a set of large gloves, and that'll be my black. And what you can do is throw on quite a few extra large blue gloves on top of that. And as you ditch your gloves, moving on from patient to patient, once you get down to that black pair, that'll let you know that's your base layer. Everybody knows how difficult it is to throw on these types of gloves on sweaty hands. So having a base layer and then throwing gloves on top of that is going to be pretty ideal. And if we go ahead and move on, so every pack I design is based off the March algorithm, MARCH, massive hemorrhage, airway, respiratory, circulation, and hypothermia. So first thing first, massive hemorrhage. The main compartment here, I went ahead and used some electrical tape, red for bleeding. And if we open this guy up, you'll notice there's a half zip here. There's 2 buckles on the side, which allows you to do that half zip, and basically you can open this compartment up and everything won't fall out. Now again, what's really cool about this bag, it is a sling bag. So when you wear it on your back, you sling it in front of you, and everything is right there where you need it. So nothing's falling out. You're not dragging your bag from casualty to casualty. It's always on you and readily accessible. So if we talk about a few things here, we'll go ahead and undo these buckles so we can open this up further. You can get a good idea of what we're working with. The main thing looking at massive hemorrhage is a tourniquet. So hasty tourniquets is going to be ideal, again, for this situation. This pack is pretty much set up for roughly 4 to possibly 8 patients, depending on, again, the scenario. So I have 8 cat gin tourniquets, 4 up here and then 4 down here. They're held together with some nylon like bungee here. So 8 tourniquets. Then we move on to this area here. Another mesh compartment with both zipper down at the bottom as well as a zipper on the top. And if we open this guy up, quite a bit of compact gauze. So we have some North American Rescue S-rolled gauze and then some more compressed gauze, both by North American Rescue and H&H. So these guys are pretty cheap. Combat gauze is the way to go. Unfortunately, it's super expensive. And when doing a bag like this, you're really trying to mind, again, how much money you're throwing into. So having a lot of gauze is, again, ideal. But if it's combat gauze, I mean, you're going to be putting a lot of money into some type of combat gauze. So anyways, H&H compressed gauze and North American Rescue S-roll gauze. All right, so quite a few of that. We'll go ahead and pull all these guys out. Again, massive hemorrhage is your #1 killer in any active shooter situation. So being able to control bleeding, pack wounds, and wrap wounds is what you're looking for. So 1, 2, 3, 4, 5, 6, 7, 8 rolls of compressed gauze. So if we move up to the top, everything on the inside is lined with Velcro, and there are dividers. So depending on how you want to set this up, you can go ahead and organize that based off your needs. Up front, we have a few 6-inch Israeli bandages, and I am able to fit 1, 2, 3, 4, 5, 6 6-inch Israeli bandages. And then moving over here, we have 2 more Gen 7 cat tourniquets. We have a 6-inch ace bandage. We have quite a few triangular bandages or cravats, which have a million different uses. So 3 of those. And then 2 H&H ABD bandages. So this is the, I believe, 8 by 10 inch ABD bandage, so abdomen bandage. So that's our massive hemorrhage. Let's go and jump into Airway. So moving into Airway, there's a small zipper compartment here. Open that up, and as you can see, we have quite a bit going on. So to open up Airways, what we are using here, pretty simple. Quite a few NPAs, nasal pharyngeal airways, all taped up, ready to go. Each one of these, and we have 8 total in this bag, has both a piece of tape as well as lubricant to go along with that. So once you apply your NPA, you can tape it down. So 8 of those. And since we are looking at a possible active shooter bag, we need to be able to close any sucking chest wounds. So occlusive dressings is going to be your best bet. For this, we are using the Hyphen Vented Chest Seal Twin Pack. So you always have 2, one for the entry and then one for the exit wound. And as you can tell, we have quite a bit of these as well. And then a few of these, we are keeping them in the Ziploc bag. And you can open up this Ziploc bag, cut it to fit, tape up all 4 sides, or 3 if you wanted to do a vented chest seal. And then last but not least, we have 4 ARS Decompression Needles. These are the 14 gauge 3 1/4 decompression needles, again by North American Rescue. So that wraps up our Airway and respiratory. Let's go ahead and jump into hypothermia. As much as I would love to throw in as many blizzard blankets and heat pads as I can in this pack, unfortunately you can't. So on this zipper right here that I labeled green, you can open that up, and inside, if we can even get to it, which we can, we are carrying roughly 6 or so of these mylar blankets to prevent possible hypothermia. So quite a few of those in here as well. Well, that about wraps it up. Again, this is my active shooter mass casualty bag. I highly recommend you guys looking into it. The main reason for me to carry this is simply because I owned and operated a DJ company for 10 to 12 years prior to enlisting. I did a lot of school events, a lot of homecoming, prom, banquets, etc. So I'd always keep this kit under my DJ booth, God forbid something were to happen. So if you're working around festivals, around schools, around churches, maybe this is something to look into. Not only is it important to have the gear to go along with your preparedness, but also mentally, get the training in. Do a Stop the Bleed class, an Airway class, be BLS certified. You know, a lot of this stuff you could find on YouTube, but it's not the same having that hands-on experience. So get out there, train, be prepared, and we'll see you down the road. I'm Braddock. Y'all stay ready.